who is going to present next. Thank you for coming. We really appreciate it. And
all right. Thank you for having me. It is truly an honor to be able to go out and visit all of the components. By next spring, I will hit everyone, I think, working on international. So gotta figure out. So thank you for your generosity and for being welcoming. And today what I'd like to do is just give you an update of where we're with and entertain any questions. This is your opportunity. Complain, good things, whatever it is, get it off your chest now. I can take it. Okay? So, this is our agenda, but we'll hopefully go through it. At the end of this agenda, I have been asked to do a tribute to Dr. Richard Thomas. I know a lot of you knew him, so if I'll say a few words that have been provided for me. If there's anybody that would like to speak, we'll do that. Okay? So, ACOEM actually has a mission and a vision statement. None of us are probably aware of it, but like any good company, we spend a lot of time hashing out these three sentences, right? Healthy workers, safe places, thriving environments. And we also have a mission, right? This isn't rocket science here. As far as our finances, so 2024 was a very good year. And historically, we have been struggling. I'm not sure if you all were aware, but the organization was struggling financially. We brought in a new CEO who pretty much revamped the whole place. And as a result, for the first time in decades, ACOEM saw a profit. Right? So good things happening. The challenge is that 2025 has been a bit of a challenge in that we had things that were unexpected and out of our control. The whole NIOSH thing with the government funding issues, a lot of folks had to pull out of AOHC. So we didn't see the profitability with AOHC that we normally do. It's also impacted our membership. A lot of people have not been able to renew, both government workers and government contractors, right? We forget how many people are government contractors and are impacted by this situation ourselves. Slowly we are recovering. We hope to get back some of those members. And as the year has gone on, the numbers have actually gotten better. This is a lot of financial mumbo-jumbo. The bottom line is it's still fine, just not as good as we did last year. And our trend is upward and it's been flattened. The thing that I do want to talk to you about is how great the staff has been with Craig and looking for efficiencies. They pretty much gutted the organization. Combined contracts, there was a lot of redundancy and wasted money. And also this year, this month, the staff is moving to a new facility. So we're moving places and it will be less expensive. So we're doing all the right things. Financially, we should be. As far as your board goes, there's a lot of us. You may know a lot of some of them are part of this people. So, your executive committee names. This is the staff. One thing I do want to let you know is that after 3 years, Mr. Craig Sandali will be leaving the organization as of December 31st. So now, on top of everything else, we are in the middle of trying to figure out a new CEO. So please, if anybody has any contacts that you think would be good in this space, we are looking for somebody with very good leadership skills first and foremost, right? We have built a really good team with the rest of the staff members. Craig has really brought the culture and the morale up in the last year or so, and we want to continue to build on that positive momentum. So we are looking for a very special person who has both financial acumen and the leadership skills to continue this positive forward momentum at FACOEM. So any names, any ideas, please send them my way. It would be greatly. Staff numbers 14. We're small but mighty. And as far as membership goes, we are still hovering. It's more than 32. It's about 3,300, 3,400, depending on the day. We anticipate we'll get more of those back before the end of the year due to the rolling membership. And there's a lot of different types of membership categories as well as lots of benefits. And we're working on the benefits now. MD guidelines, I can't say enough about it. It's an untapped resource that a lot of us don't think about, but it's out there. And I encourage you to explore it for both your clinical needs as well as for standing. And like I said, 2023-24, we were actually seeing positive membership. Now we've kind of plateaued. We're going to get it back. I do want to talk a little bit about fellowship. Fellowship is super important in that these are our future leaders for the organization and the specialty. The concerning thing that we found is that with the decline, with the membership that we've lost this year because of financial issues, there's a good chunk. At one point, it was up to 40 that were fellows in that non-renewal category. You need to realize that you cannot call yourself a fellow if you're not an active member of the college. And that is a big deal. Also, our fellowship application period is right now, and it ends in November. So I'm highly encouraging folks to consider fellowship if you haven't already. And these are the three members that of these components that were made fellows this past AOHC. So if any of y'all are in the room, can you stand up, please? Anybody? Yeah. Thank you. All right, so fellowship. These are our components at this point in time. And the board just reviewed what the thought process and the value of components are. And, you know, me visiting all of you really reinforces the fact that components are very important to this organization. It's that close-knit group. You know, you all know each other. It's regional. You can talk about regional issues that maybe we can't do readily at a national level at AOHC. So if there are any ideas where you think that national can help the components further, then we'd like to hear that. Okay, so please, it's an open door policy. We can't help you all if we don't know what it is you need in the future. So some of the things that ACOEM has been doing, obviously, we have three main missions. We do advocacy, we do education, and we do NET, right? That's the three things that most members want from us. As far as our advocacy initiatives, obviously, the funding for residents of the programs has been first and foremost. I thank you. We put a lot of effort into that and doggedly pursued folks at HRSA, at HHS, in senators, congressmen, you name it. We were doing a lot, especially the first 3 months after AOHC. And we did get feedback that it was because of our advocacy efforts and our elevating the issues to people's forefront that the funding was eventually released. So we're good for this year, but as you know, the years after this are not guaranteed. And so we're continuing our efforts in BC. We have a new advocacy group working with us. We had Dane and Cascade Associates prior. Now we have a new advocacy group that is working with us, and they're very good as well. So, we've got a problem, and we've got to start thinking outside the box. We've been interacting with the residency directors as well, looking for ideas. It seems like a lot of folks are going towards exploring private funding through corporations, insurance companies, also going to the state level, right? Every state is different, though, so it's hard for ACOEM to assist with that. If there are any ideas or ways that we could potentially assist locally, then you need to reach out and let us know. We'll do what we can. But we need to know what you do. So we are continuing on that. We're also doing other things as far as letters of advocacy, responding to requests for comments. There's a lot of active work going on, and we constantly need people to help us write comments back to the fellow. So if any of you are interested in doing something like that, please get in touch with me or Julie Ording, and we can put you in touch. We can connect you with folks depending on your interest and what needs comments. Okay, but I've got, the government's got a list of regs that they want to go through, right? And we have been systematically presenting comments for each as appropriate. So we do have a future fund that was started after AOHC. Presently, there's only about 15,000 in it. So if any of you are independently wealthy and would like to contribute, the idea is that this money would be used towards training, residencies, things like that. And we do have a working group that is also exploring foundational funding and outside the box funding for residencies as well. Guidance papers. We are always writing guidance papers. We're about to come out with some new ones, but hopefully you all are aware of these. And of course, on our education front, AOHC is coming up in April. We have the Fall Summit that is coming in November. So if you're still in need of CME, we have that. And I encourage you to take a look at that. We are also updating some of the core courses, including commercial driver and medical center occupational health. AMA guides have been done for this one and are available. And as we always do, we're looking for people who need awards. So if you can think of anybody that you would like to nominate, please feel free to get it in sooner rather than later. People always ask, how can we get involved? This is one way of getting involved that is a lot of fun and gets you out into your community. This is the ambassador program. If any of you are interested in doing something like this, please feel free to get in touch with us. It's a really good program, and it helps get the word out on occupational medicine for students, residents, folks like that. We've even gone into colleges. So let's talk a little bit about this, about people. And I started receiving emails from a whole bunch of folks saying, we need to do a tribute to Dr. Thomas. And it wasn't until I got his picture that I realized that I knew Dr. Thomas. And so this became personal as well to me. So I've been given a statement that I'd like to read to you. Dr. Richard Thomas's career represents the highest ideals of service, scholarship, and mentorship in occupational and environmental medicine. His life's work bridged the military, federal service, academia, and national policy, ensuring safer workplaces, stronger health surveillance, and better prepared physicians for generations to come. He will be remembered not only as a pioneering leader, who shaped national OEM standards in advanced environmental health, but also as a teacher and mentor whose influence lives on through the hundreds of medical students, residents, and colleagues he inspired. Dr. Thomas stood as a pillar of the OEM community, a physician who dedicated his life to protecting the health of service members, workers, and the public, while advancing the specialty he so deeply loved. His enduring legacy is a healthier, safer workforce and a stronger profession. So, in tribute to Dr. Thomas. Is there anybody that would like to say something about Dr. Thomas? Raise yourself, please. Please stand up, come to the mic so folks can hear online.
Technical high-tech things. There's AI when you need it. Okay. Hi, I'm Ken Lincoln. I recently had the honor of attending a memorial service for Dr. Thomas in Annapolis. It was 2 weeks ago today. And like many of you, we knew him. I just wanted to add in there just a couple things that speaks to some of the things that Laura went over. One of the things that might not be in his official biography, and you learn so many things, unfortunately, about people at funerals and memorial services, but he was so traditionally, if somebody he went to the Naval Academy, and traditionally people had to go out to the fleet before they even thought about any kind of other programs. But Dr. Thomas was actually one of the very first Naval Academy graduates in the history of the Navy that was actually allowed to go straight onto medical school after the Naval Academy, showing how that he really was a pioneer, not in this field, but in naval service. I noticed on his jacket he spent a lot of time doing like real Navy stuff on ships. I know we like talked about Cocaine Korea, which is another kind of big, gritty industrial stuff. He did a lot of gritty things. He was on submarines. He was up the North Pole. And we were talking about mentorship, and I just wanted to just add a personal note. In 2003, and thank you to to ACOEM, because I was able to substantiate this on the website. It has a list of all the things that you've registered for over history, and I forgot when this was, but it was 2003. It was during the SARS epidemic. Remembers that it's an old person, but we had SOTAC in Toronto, and it was just as the SARS was breaking out. I was a family medicine doctor, and I was very interested in occupational medicine, and I was mortified though because the Navy, on active duty, the Navy had just issued an edict. I know this is hard to believe in the federal government that people would have issued sudden edicts, but the edict went out that from now on, Federal has declared no more second residency. You cannot do another residency. Now I'm basically host because residency. Now what do I do? So I met Dr. Thomas in Toronto, and with his mentorship and with what he knew about the Navy, he was able to position the residency for occupational medicine as a fellowship. And you're a good family friend, and thank you so much for bringing this up.
Well, thank you for anybody else?
Hi. Well, I'm Hans Lundquist, and I am the incoming president of Metro Washington. Dr. Thomas served in every single position on our board. He was a man known to volunteer. Essentially, if you raise a hand, if you ask someone to raise a hand, he raised his hand and he did it. I first met him as a resident at the time he was a coach, and he mentored many people, including, I'm sure, many in this room and many on the call. I consider him the type of person who is fortunate to meet, to have a role model to look up to try your best to emulate. I too attended his memorial service along with many others. And one of the things he volunteered for, along with many things he did as a mentor, as a teacher, as a leader, as a protector of our workforce, at his church, he volunteered to visit the gravesite of people who otherwise were unknown. And this is that grave after the service, just receive a kind of selfless service Dr. Tom provided. And honestly, his tentacles reach everywhere. So I think it's just very important for us here to remember Dr. Thomas. Look up and each day try to do something good for our for our families, for the community we belong to. And if we forget about it, just think about Richard Thomas. That's what it is. Trying to put my computer. Yeah, every time it's some of the older stories, the great ones are separate ones are maybe starting with some where does he see what it's like? But I just want to use the neural I think I did. And very specific memory. Just to kind of talk about 56 of them. And I think about all of that. I need more time. We were sitting in listening employment physical video work or something like that. And this employee had an MRI scan. And for those that know the medical center, it's a large hospital. It's a very large, not a healthy hospital where it's quarter and dirty in here. It's very large. I'm using mine. Easy to get around. And he was saying, I see on the appointment you have an MRI a little bit later this afternoon. We had planned counseling for sure. And the employee said, do you know where it is? And so most people would say, go outside all the signs and then you're there. And I remember this so distinctly. He said, Jeff, let's show him where the MRI machine was. The employee was clearly at the park day that day. So we got up and we walked him to the MRI. And at the time, we talked, I know about this with him, I was annoyed, like, I'm going to some cases and things like that. And I think that he was so thankful the employee was, and it stuck with me. But we really don't do this all that much. He was certainly a clinician with a patient and a manner. And that was actually every single day that I see patients that day. I am so thankful for my career.
Well, Hobson, Richard joined OSHA as my deputy back in the early teens, and I hadn't met him before. I could be in ACOEM. But one of the things that came up earlier here now is patience captures only part of that in strategic activity. Richard was apt to see a longer goal that conflicted with institutional and organizational rules and priorities, and figured out how to work his way through the constraints of the systems that we all live in, not breaking rules openly, but patience, waiting until the rules kind of softened and got to where he was. It was an amazing thing to watch. It was just stunning what he was able to achieve working against, through, and with the administration to get, for example, residency funding in OSHA that they had refused when they did. So, amazing.
That was my experience with Inter-One Medical, Merchant Mariner Medical Advisory Committee as well. You were great.
My name is Marcus, and I took over as treasurer from him at MWCOEM. And the biggest thing I'd say is we can all attest to right now we're in some very challenging times. And the one thing that to Richard, as you all heard from everybody before me, and I'll say just continuing to contribute to the community, is that he's taught us how to do the resiliency to endure weather and times. He had his purpose, self-assertive. He invested actively in his faith, invested actively in his family, and invested actively in his profession, as you've heard from everybody else. So I think for me, that table from his contributions and hopefully embodied by example, but also helped us see when we get lost in these murky waters of everything going on, how to regain clarity and push forward.
So there will be, I believe, a tribute to Dr. The ACOEM quarterly. So we can look for that as well. But, and at this time, I just want to say thank you and open it up for any questions you may have. Go ahead.
Just quickly, the federal reach too that I know with.
Do you want to come to the microphones with the folks online? Oh, that's a great question. It's come up before. I believe that they are allowed to join whatever component they want, but I will check on that and let you know. Okay, it's been a topic of discussion, and I can't remember where we landed. Because at one point they were looking at international component, but others, especially for Puerto Rico, were thinking it should be part of the U.S. component. So,
But I know with public service reaching to do with New York, New Jersey, Puerto Rico, and the Virgin Islands. Having a conference there sometime might be fun.
Also expensive, right? Talk to Walma, they're doing theirs in Hawaii next year, so it's super expensive. But anyway, all right. Anything else? I will get back to you on that one. All right. Well, thanks again for the opportunity. I appreciate it, and have a great time.